Good morning, ladies and gentlemen. You are listening to The Local Lens, a podcast where we go inside one community's experience with the drug epidemic. This is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. And this show is all about gathering as many unique perspectives on the drug epidemic as we possibly can. So on today's episode, we have one of the most unique positions that we could get for the interview with Judge Executive James Anderson. Now, what makes Judge Anderson's perspective so unique is that he sees the entire county budget. He sees how all the different county programs and public services all tie together, how they all overlap, and how things affect each other. So he especially sees the amount of strain that the drug problem here puts on the rest of our community. So leading up to this episode, he told me he wanted to focus on sharing the financial impacts that dealing with the drug problem has on our county. So you're not going to hear much emotion on this episode, and that's not because he doesn't have any emotions or sympathy towards the problem. It's really just that we decided to focus on the finance and numbers and how that affects our county in that way. Well, anyways, that's good enough for an intro. Let's go on and get into the episode. This is The Local Lens. It's a Powell County Health Department project from the Powell County Cares program. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do.
Yeah, as he said, I'm James Anderson. I've had the good fortune of serving in my capacity for almost 9 years now, and excited to have the opportunity to discuss one of, I think, the biggest problems we have here in Powell County, probably. I think it's not just Powell County, so I shouldn't just put the stigma here. I think it's a nationwide problem, but the opiate or the drug problem that we're seeing in our society today, and I think financially the woes it brings to economies locally and nationally, it's something that's very underlooked, and I think a lot of times we see it from the angle they'll tell you what a needle program cost or something as that, and I've always made the argument it's more what it costs us if we don't do it, and I think it's hard to formulate numbers or cost on those things that are not tangible, but I think that's going to start to be the mentality we have to look at more so than the cost of some of these programs, because we're starting to see the impact of that now as it continues to grow. If you look at our county budget, it's $12.5 million. If you look at the ambulance and jail aspect of that, that's over a quarter of our budget. And then looking at those, basically probably 80% of those costs associated with those two departments alone is from this drug problem. And then that starts touching you from an economic development standpoint. We have a lot of things we face, rural broadband and stuff, but if these monies wouldn't have to be allocated to cover such cost, good chance we would have had some of those things. And then from the perspective of trying to recruit industry in and such things, that really has a big factor on our what workforce we have available to be attractive to those folks. So it hits us all over, and I think if people would realize the cost of inaction and what it's costing us is a lot greater than the cost of actually taking productive, proactive steps and trying to combat it, is my opinion.
So we need to keep that same sentiment in mind for the rest of the episode, because mainly what we're getting at here is that as long as we're spending money having to directly address issues involving the drug problem, that's taking away from where we could be spending our money elsewhere. So through that way, it affects all of us.
Just trying to utilize what limited resources we have, and we've talked about the cost, these direct costs, but also I think it's going to be hard to ever quantify. We lose a member to this addiction. What does that mean to their productivity in the future if they'd had been a good tax-paying, viable citizen? So there's cost, and then as far as the social capital we lose, and I think just you see it in our school systems, kids from broken homes that don't have that. So how's that kid's life going to be impacted through the future? So it's not just attacking the person that's affected. It's the whole family unit and the whole community for that matter. So I think that's sometimes lost in this thing too.
And these are long-lasting problems that they don't just go away overnight. They don't go away once the person is in recovery, even.
What are going to be the long-term health ramifications of even the people that get clean? No doubt they've had those years of usage. They're more than likely going to face complications from that in the future. So And I think that's another thing from that. If you'll see the distribution of wealth in this, you've seen families all the time that grandparents, parents, all their resources have been, maybe their life savings are going to try to get this loved one clean. So, you affect them it's affecting 3 or 4 generations. And just use an example such as that here in our community, if those people had that money, where would it have been spent or how would it have been invested in our community? Not that it's not a worthy cause, but now it's going to healthcare providers or clinics outside our community. So you're seeing a redistribution of wealth and assets outside our community. So it has many financial implications on our community beyond the pure need to do the moral and ethical thing and try to get these people help.
And looking at the healthcare is also just one part of a much bigger picture, because we also have a need for healthcare, and the need exists for a lot of reasons.
How do you see our need for healthcare in our community here?
That's very much, and I think it's kind of unique here that we're in this pandemic, kind of even manifested more. But I think being in a rural community, not having access or readily available to these people definitely is another hurdle they face. Whereas if they'd be a Fayette County or something, a lot more resources. And so just the expense of getting these people to the options, if we have to go outside, is another disadvantage that the folks in our community face in that. And I don't know how it will work, but what I was kind of getting at with the pandemic, hopefully this, and that's what I said, even the CDC should look as much at internet access as they do vaccines and stuff in these pandemics. Same thing with I think that's left us at a disadvantage in this trying to combat this drug situation. Maybe some of those options, telemedicine type things or sessions, could be worked in and make it more available to those people in need.
So let's walk through what that would kind of look like then, because that's an interesting point. How important of a step would it be to get internet and the broadband through our whole county?
Yeah, and we've got some projects ongoing. Naturally, the cost of those, going back to where we're having to allocate funds that could maybe expedite that. And if you look at the current financial state, I guess, the nation, especially in the state, makes those steps more challenging. And that's what I say. Almost some of these monies put into combating that, even though it doesn't necessarily look like it should directly impact, maybe some of these funds should be allocated for that, and see what models could be developed that would make the help they need more accessible, I guess.
So if you grew up in Stanton, then you know as well as anybody else on the planet how quickly word can travel through the community just through people talking. And while that's incredible in some situations, it's probably not the most helpful in all situations.
Yeah, and I think, one of our strengths and one of our weaknesses too, being in a small community, naturally knowing most people, there's a comfort, but then also there could be an embarrassment or stigma they're afraid to be associated with. So if they're to a point in life where they want help or need help, nothing more than not wanting to go to somebody they know to admit that could be a challenge here. So I think if you had other options that they didn't necessarily have to know who they was going to ask help for, might open the door up to more people to get treatment than what we currently have available to us as well.
Alrighty, guys. Let's stop and take a breath right there real quick. Hopefully by now you can see that these roots spread all over the place and they go deep. Everything is connected. Everything affects each other. And that's why we're very lucky to have Judge Anderson on here, because from his perspective, he can see those connections better than pretty much anybody else in our county. All right, so let's get back into it.
Before you took your role as the judge executive, what was your view, has being in that role shifted your view at all on the drug situation?
It has. I don't guess I had even a start to have a full understanding of the economic toll it has on the finances of a county or city or national or state government. I mean, you could see you could see it, I guess, what you just as far as maybe what the cost of that individual, but you didn't see how it played out, through the court costs, through the EMS. And if you look, these same population are using, that's our court system, probably 80% of it's drug or some drug-related issue that's brought them there. Our jails, that's why you see the capacity problems throughout the state. Most all of that's related to that. Same thing with our EMS. Typically, if they get in this cycle, it's nothing, unfortunately, to see the same person maybe in the same day OD. So and that takes away, when we're having to distribute those assets to that problem, you have a normal health thing such as a heart attack or something. It very well may be that our emergency services are tied up trying to address these and unable to render the help that the person having a heart attack is. So it's a bleed on all of our society and our finances. Yeah, and I think if you worked as one of our first responders, it naturally has to be. It would be real easy in that position to start to get hardened toward it. When you're going to the same address 3 or 4 times, especially in a couple months' time,
And that points back to an actual thing called compassion burnout that's experienced by a lot of people in all kinds of caregiving fields. So it's not that the EMS doesn't care, it's just they do it a lot. Their lives are surrounded by dealing with this.
There's really a balance, and we have wonderful first responders that do their job, but I know they get frustrated going back to repeat things, and that's not necessarily what they signed up to, or what they thought they was getting into. So it really takes away from why they signed on to that. So beyond the addict, we need to give some relief to our first responders and try to get this treated in a manner and not using those as the first line of defense for it, I think.
Yeah. What do you think we could shift towards then, more so?
I've saw, I think a lot of the monies that I've saw come down from federal and state, and I think that's one of the disadvantages. I think it's become apparent to them now that we have a significant problem. I'm not saying it's insincere, but I think all too often they want to throw some money at something, regardless if it's a proven model, just to make an appearance that they're trying to address it. And I think a lot of what I've saw, especially federal and state monies, come down to are probably not the most effective in what I've witnessed. And so a lot of the shorter term type things, or even some of the educational components, not that they don't they're not for good reasons, but I just don't think they've been that effective. So I think there needs to be a time to step back and really look at what is working in these things and start trying to direct the money to more effective models than just throwing it broad blanket and just this is for opiate, but no specifications as really to what it goes to or how we're using it.
But it's been surprising just how much there is still to be understood about what actually works. And then you'll get in and you'll talk to people, and a lot of different people that are knee deep in the problem and stuff, and knee deep in working on it, they'll say that they don't think anything will work broad blanket. Everything kind of has to be formed very much to that specific situation. And that, at the very least, would be a lot of manpower to have a system like that where it worked.
Yeah, I think if you look, and what I've witnessed is most of the programs that have the most success are faith-based, or tend to be, and that gets a real touchy, I guess, when you get into government funding, going to a health base. So I think there's a lot of proven programs that work that may not be eligible for funding just because they are attached to a church or a faith-based organization, and I can appreciate that, but that's where we've got to come up with something to fix that model, because those seem to be the most effective in what I've witnessed. So ways to work around that or something may be very helpful.
All right, ladies and gentlemen, I'm going to take this opportunity to hop on a soapbox and talk about one of my favorite things that happens in America, the small nonprofit organization. I think small nonprofits are just incredibly important to our society, because what's happening in a nonprofit, that's the government is looking at this small organization and saying, okay, we trust you to address this problem, because the small nonprofit that is locally based sees and understands that problem there much better than the state government is going to, much better than the national government's going to. And if they're a small group, then they're able to work quickly and address the issues as they come up. So this is groups like Spark Ministries and Celebrate Recovery here in town. These are two incredible groups that do so much awesome work for our community. And it's because they've garnered enough support from whoever it is that they make the money work. That enough people believe in what they're doing, that people give them money to keep doing what they're doing because it's really helpful to a lot of people. And I think these groups and other groups like them are necessary in communities. And it's important because government groups are not allowed to be religiously affiliated, but your nonprofits are. For a nonprofit, all you have to do is be able to raise enough money to keep doing what you're doing. So you look at groups like Celebrate Recovery and Spark Ministries, and they're allowed to be religiously affiliated because people see that they're effective in what they're doing. People are going to continue supporting them as long as they're doing good work. And that may be what's necessary, because speaking to somebody's religious side and that spiritual side has been very effective, just as Judge Anderson says.
And I think that's something that's lost in this fight. I think people that's been in addiction and stuff, it's not a magic pill you can give them. It's more a holistic thing. As I said, you got to heal the mental aspect of it too. And in my faith, I think I've got to have that spiritual component that might be different for other people. But I think wherever they find that solitude or guidance, they've got to have that incorporated into their program. So.
Where do you see our county in addressing mental health issues at all? Because I know those go hand in hand with addiction.
I think there again, because of our size, we're very limited in the ability to do that. And I think, even such as the Casey laws and stuff, some of the evaluations those people's got to go through, that's why I said we don't have the resources. I know Miss Coffee here locally provides a lot of that. If it wasn't for that, we're a lot more limited. So, and I actually just recently saw where one of the it's one of, I think, city police departments here in Kentucky, instead of hiring more officers, they were actually hiring some mental health evaluators because they realized that arresting that person is not the cure. What do they need as far as housing, as far as food, to get them on a path to where they can be sustainable. And I think we touch on a good point there is beyond what we're doing locally, and you keep hearing about reform within our corrections facilities, but I think that's where, especially in a state, we've got to step up and see how that's going to tailor to it. Locally, I use the example, we have the work release program, and typically we have 40 people there, and when they're in that capacity with that supervision, they're very productive members. Most of our food banks, our transfer station, our animal shelters are all pretty much staffed, and anybody that lives here can testify to that, especially now when we don't have them, the slack there. So they provide a vital service, are very valuable members to what we do in the community. I think nothing more than reforming that. If instead of them per se being incarcerated, if they're, I think if we would provide private contractors and stuff with the ability to utilize that, provide home, housing, drug testing or what, I think there could be a lot more efficient model. And, that'd be a pretty good chance for a person to work, have a chance to see. And I think that person going out of incarceration, having the ability to step into a home and a job, the recidivism comes real quick after they're released. If we can bridge that gap and give them the best opportunity to succeed, I think we could really start to combat that. And the longer we can keep them from addiction, the likelihood of them going back is a lot greater. So I think we're really missing that in our corrections, the current model of our corrections.
So just to timestamp this episode, we recorded this interview back in the summer of 2020, which was a time that was characterized by people demanding police reform. There was a lot of unrest in the country, and a lot of people were questioning why we ask our police to do so much.
It is interesting that some of the places are trying to and some of the counties in the state are trying to address the mental instability side of it, because like you said earlier, if you can kind of cut off some of the people getting into the jail program at first and keeping them out of that whole cycle, then you have to wonder what kind of effect that would have.
Yeah, and I think here I think locally we're very fortunate to have a very good law enforcement. I think overall, that's what I said, throughout the nation we have wonderful law enforcement. And unfortunately, we get a very small percentage, but at the same time, I think kind of what we talked about, we're expecting our law enforcement, like you said, to be the mental health provider, and we're really tasking them with a lot of things that are not in their wheelhouse. And if we would appropriately address the drug crisis, opiate crisis, and the corrections problem, we could really take a lot off the plates of what we're expecting our law enforcement officers to do that they shouldn't be doing. And I think they're kind of really caught in a vacuum here. They're having to play a lot of roles that typically shouldn't be theirs.
And that calls back to looking at the EMS. The EMS is very burdened by a lot of stuff that wasn't exactly in their job description. And we are absolutely not saying here that we should neglect paying attention to addiction or neglect helping people that are going through that. What we are saying, though, is that we can do different things to address the problem so that it's not the EMS or the police force having to address these issues.
It seems like we could try different things at least,
but it gets scary when you get to the point where you have people in the public that are against the Narcan and against the needle exchange, and that's why I said I hope if they would look at it beyond what we should be trying to do for that individual, they got to realize economically and financially what that means to the community, and that's if they can't see the personal side, that at least see the financial side and realize that we're all in this and we're all been impacted whether we realize it or not.
Do you know specifically anything about like the impacts that Narcan or the exchange program specifically have on our finances?
Looking at the numbers, but that was one of the points I made. I know it, and we was very fortunate in Powell County. We didn't have near the resistance. Even I know Scott County, which you would assume would be very much for it. We didn't have near the kickback or fight against it. But one of the points I made, even in that cycle at the time, I think, a case of HIV, I think, equated to right at $500,000 of taxpayer, somebody's funds to treat that case. And I'm thinking like at that time, Hep C may have been like $180,000 price tag. And that was the very point I made, And that's the unfortunate thing about it. Effective needle exchange, we won't be able to quantify how many of those we prevented. We got to know what common sense tells you that you've naturally slowed the spread, if not stopped it in a lot of instances. But you take, just roughly the $480,000 HIV treatment in a lifetime in Powell County. If we prevent one case of that, how many years worth of the needle exchange would that, pay for? And that's, I think that's lost on a lot of people. So, like you said, unfortunately, we can't say, well, we definitely stopped 5 cases of HIV, and that's where it's hard to quantify and make justification. But I think we can all, if you look at the people that work those and the amount of people that's got help, or the people that's been identified that has one of these diseases, there's no doubt we've curbed some of those cases here in our community. And I think I think something that's lost on a lot of people too. And from what little I know some of what they do, but the needle exchange has also been an opportunity for outreach. They've been able to actually connect with some of these people and be able to guide them in places, resources for help. And so. I think that's a positive thing. You had somebody that may have initially went there no more than trying to get a clean needle, but as they've seen and the care those people are providing, there's been people that's got treatment and maybe at initial start they wasn't ready for that, but sometime during the course of that they've woke up to that and they've had somebody to direct them in the direction they needed to get the assistance they needed. When I graduated high school, you heard of a little, and I guess where kind of my perceptions changed maybe through the years. That time, maybe marijuana was the worst you would hear somebody doing. It was mostly just alcohol and things. And I think back, we were all young and dumb, probably made decisions we wished we hadn't. And that's what I've tried to tell people, that, I guess back to the disease or disability type thing. There's kids making the first time decision that instead of a bottle of alcohol, now maybe it's a pill. And, the likelihood that the first bottle of alcohol got somebody addicted is very unlikely in most instances. Whereas the first couple times with the substance that they're exposed to now, been of the same mindset of somebody 20 or 30 years ago, they now may be in a place of addiction. So it's a very different animal than what even in my generation we grew up and exposed to. So the same stupid decision somebody made then might be totally different than it was back then. So I think they need to realize how the times have changed and what our newer or future generations are faced with is much different than what we encountered back in those days.
So I think it's important to remember, though, that a lot of the changes in the drug scene that have happened are also alongside the changes in the medical scene. And you have to take both sides of that coin. If you want the medical advancements, the improvements of pain care, then you have to accept that some people are going to abuse that medicine as well. So while it is frustrating to consider that, the pharmaceutical companies that brought us these pills that have changed our society so much, you have to also appreciate the medical advancements that have come along as well. There is a place for this medicine, but you have to be careful with it because it's ridiculously powerful stuff.
And I think you kind of hit on it. Within the medical profession, there's many good, but also you had some bad doctors and some bad pharmaceutical companies that were nothing more than profit driven, and that's what really sent us down this road. And I think we got to be very cautious going forward in the treatment phases too. And I'll be, that's I'm going to use for example, and by no means I'm a medical expert, but in what I've read and what I've saw, such as Suboxone, I think there's definitely a place for that in the treatment process. I think more often than not, though, we're seeing the same deal with doctors and companies that's looking for profit versus treatment. When you have people, in my opinion, not a medical one, that's relying on that a decade later, are we doing what we should to get that person whole? And I think not. So, we got to be cautious as we move forward that even with the treatment components, there's going to be those bad actors that look to profit, not to help the person. So
yeah, and I know the little bit I've seen inside of that too with Suboxone. If people are using a program to use it, if there's a written plan, how you start with it to how you're past it. I think the goal is to get past it. The goal is to not create dependency on it.
Exactly.
And that's something that you as a user or you as a participant in the program can look for and purposefully seek out with it.
Exactly, and that's exactly right. We shouldn't just be switching addictions. We should really be trying to help that person.
So that wraps up a conversation that spreads over a lot of different ground. But what else do you expect from somebody that his job is to look at everything that goes on in the community? So very naturally, all this stuff runs together. And that's the reality of it. The longer we have to pay specific attention to addressing the opioid problem, the less we can focus on addressing other issues that our county faces. But for the time being, we're still working on it, still hacking away at it, trying to make it a little bit better than it was before. And if that's something that you're interested in joining, then reach out to us at the Powell County Health Department, or reach out to us at the Powell County Cares Facebook page, or even the Local Lens Facebook page. There's a lot of work being done, and there's plenty of room for everybody, so come on, join the fight. Well, anyway, let's go on and get this wrapped up. Once again, you've been listening to The Local Lens, a Powell County Cares project from the Powell County Health Department. I'd like to send out a few thank yous before we go. First of all, to WSKV for broadcasting the show for us, to the Health Department for letting the show even be a thing, and then also to Judge Anderson for doing good work in your position and for giving your time to be on the show. This is your host, Nate Brooks. Thank you guys for listening. Really appreciate it. These are our people using our voices, telling our stories, because no one sees it like we do.